you can't be involved, I don't think, in medicine and be a Luddite. You can't be against you can't, have this balkanized view that Jeff said was bad. It's bad for social change, it's bad in the social sector, it's bad in medicine and public health. To believe that everything is a competition between scarce resources is going to doom a lot of the work that Jim has worked on, or I would work on, or many of us work on. It will doom it to failure to have that kind of. We need just as much in global health, for example, that commitment to the bigger vision. And you asked me what that was, but I just want to say I feel that what I'm saying is really echoing what Jeff said. He said green is green. I understood the metaphor. Actually, Harvard's pretty savvy. They have quite a Harvard, they have a slogan there that I see at the medical school all the time. Green is the new crimson. So here it's just green is the new green at Dartmouth. But I think where we're going is, again, systems thinking. In medicine, the interaction with an individual patient, whether that be in Haiti or at Harvard, you need to be attentive, you need to be listening to what patients have to say. But if you can't take that individual experience and put it into an interpretive grid that is really systems thinking and drawing on the evidence, then you're not doing your patient a service. You could be the most compassionate person in the world, but if you don't know the literature, if you don't know the data, if you don't know what's going to help that person in terms of prevention, diagnosis, or care, you're going to do a disservice to the patient. I see global health the same way. If we cannot apply systems thinking to, and this is why, as Jim said, we asked Mike to spend time with us in rural Haiti. We said, go to the clinics, see how this is done, help us find ways of doing it better. And that's really the future of a lot of these initiatives. And I'll give one specific example, and then if we fight for an idea, and that idea, the grand idea is, let's say, social justice, equity, fairness, whatever you call it. And some of these words are sort of tarred, inappropriately, I might add. But it's fine to say social justice, the idea that people deserve a fair shot just because they're humans and they're on the earth. You take an idea like that and let it drive forward a program. And Jim has been a master at this, in my experience, working with him. The implications of saying, well, it's not a good idea to say you can't treat cancer in rural Rwanda. What if cancer is a big problem in rural Rwanda? What if it is, by the way? So that's not the good idea. Is no, we need an idea that everyone deserves a fair shot. Then you apply systems thinking. How can we bring down prices because of what pooled procurement? Jim taught me a lot of these things back in the early 90s. And that's a specific example, talking about cancer prevention, diagnosis, and care in rural Africa. A lot of people who are constrained by this idea that we have very limited resources. How many times do you think I hear in the course of a single week, but we're living in a time of, really constrained resources? And what I've tried to do is learn how to say rather cheerfully, mind you, that's another trick. Ruth, how did I do? Cheerfully, yes, that's true, but they're less constrained now than they ever have been before in human history. So what is the new strategy to drive forward the big idea, which is equity and social justice? What are our strategies, to make this a systematic approach to these problems? That's the big future for global health. And I'll just say, to link global health to social justice movement, we're going to have to also get together with those environmentalists Jeff didn't like. I'm kidding. I bet you like them now, don't you, that green is green?
So there are many things I've learned as I've aged, Paul. Yeah, I've mellowed a little.
Bringing together these two big movements, in my line of work, and this happens a lot in universities and colleges. You bring together the social justice movement, people talking about fair trade, and these are young Americans. They care about this stuff, and then bring that together with the movement for environmental justice and saving the planet. That's going to be where things are going to go forward, and just avoiding this balkanization and saying, if I profit, he or she will not profit. That's not true. Any doctor working like we do in places where we do know that people will be sick if they don't have jobs. And they can't have jobs if we don't have a vibrant industry and growth beyond the sectors that we might work in. So I think that that's where this is moving forward, is a less balkanized view of the world.